Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, the Executive Director of Speaking of Women's Health, and I am back in the Sunflower House. And thanks so much for joining me. On this edition, we are going to be speaking all about vaginitis. It's certainly one of the irritating and annoying conditions that most women deal with at one point or another in their life. And some women deal with it recurrently, and it can be very disruptive to their life. So we're going to focus on this episode talking about some of the more common types of vaginitis, primarily bacterial vaginosis, BV, which is a condition as opposed to inflammation. So it's not an itis, it's an osis, BV, bacterial vaginosis, as well as other common causes of vaginitis, including candida or yeast. They're both common and both very annoying, and a lot of times they're misunderstood. So I'm giving a shout out to our lead nurse at the Center for Specialized Women's Health, Alexa De Los Santos Brown. She's recently married. Congratulations. She's our lead nurse and she handles lots of questions. And she said, you have to do a podcast on vaginitis. I get so many questions and there's a lot of misunderstanding. And there's a lot of good things to do to prevent as well as treat. And we have all of this information actually on our free website, speakingofwomenshealth.com. If you don't already have that bookmarked on your smartphone or your computer, please be sure to do that. And part of the reason that she gets these calls and conditions is another very common cause of vaginitis is atrophic vaginitis, which has actually been renamed genitourinary syndrome of menopause. Because at midlife, or whenever it is that a woman loses her estrogen via loss of eggs, naturally, surgically, or chemically, the part of the body that takes the biggest hit is the vulva and the lower part of the vagina, which also includes the urethra and the base of the bladder. And when there is thin tissue, the cells get very thin and they don't have energy source as much, glycogen, which is a sugar. And when we treat women to restore the normal mucosal integrity when they have GSM, genitourinary syndrome of menopause, the normal health of the cell, including the glycogen, is restored before the healthy bacteria, the microbiome, get established. And it's very important in the vagina to have the right healthy type of lactobacillus, which helps keep the pH of the vagina acidic. And so for some background information, if you're a postmenopausal woman, if you have been treated for atrophic vaginitis or vulvovaginal atrophy or GSM or corrosis vulvae, or you're anyone over 50 who's had vaginal problems, you might want to go back and listen to last season's June 6th, 2023 podcast on everything breast cancer survivors need to know. And you don't need to be a breast cancer survivor. It's just that they tend to many times not get their vaginal atrophy and GSM treated. So there was a big focus on that. And I think it very, very instructive. So when you take a very thin lining and make it thicker, healthier, and plusher, better blood flow, and then glycogen returns inside the cells, normally there is bacteria and also fungi like yeast on our skin in the vagina. And one of the energy sources is glycogen. And those fungi or bacteria can overgrow and get access to the nutrients if the pH is up. So it's very important to keep an acidic pH of the vagina. And so when sometimes women get treated initially for atrophic vaginitis, GSM, they may notice they experience a yeast infection or BV, bacterial vaginosis, and they blame it on the local treatment, which it really isn't. It just hasn't taken long enough to then establish the healthy bacteria to help bring the pH of the vagina down. Another really good podcast I did last season is on vulvovaginal care, and I certainly would refer you back to that podcast. And that's we also have a column on vulvovaginal health tips by Dr. Lynn Simpson, who was a physician who retired a few years back. She was excellent long-term GYN, and I think that's one of our most read columns. So that just goes to show how important and vexing a problem this is. The other thing when you treat atrophic vaginitis and you restore the health of the cells with glycogen before the microbiome is reestablished and you get the lactobacillus, the healthy bacteria, and the lower pH of the vagina, sometimes there's a slight increased risk of bladder infections. And then women will say, I thought you said this vaginal treatment was going to reduce bladder infections, which it does, just not immediately. So the microbiome in our mouth is very important for teeth and dental health. We talked a little bit about that in last season when I interviewed Dr. Margaret Richards-Frankel, a dentist interested in leading edge, not just cosmetic, but oral microbiome, as well as oral breathing care. The gut microbiome influences many different diseases and risk for diseases, as well as GI symptoms. And the vaginal microbiome is very important to the genitourinary system. So if that microbiome gets disrupted, you can have symptoms, irritation, inflammation, possible infection. So what is vaginitis? Well, it's a medical term that encompasses a lot of common disorders that can cause the vagina to become irritated, inflamed, or outright infected. Now, vulvovaginitis refers to inflammation not just of the vagina, but also the vulva, which is the external female genitalia. In fact, my granddaughter Artemis, who's a little over age 3, she is just so hilarious. She, when she wants some Desitin ointment put on her vulva after a bath, she'll sometimes say, Mimi, my girl parts are irritated. And she's also called them her passports because when she was returning from an overseas European trip with her father, and I think it was at least 3 flights, and her mother and her little baby sister, it was a long, long trip back. And at the airport, naturally, as a toddler, she was getting a little bit tired, and she started to hit at her father's Stetson and whack at his belt area where he had all of their passports so they could travel to different countries. And he said, hey, you're hitting our passports. So now she refers to people's private parts as their passports. So it is important that, of course, we adults use, the correct terms, and not everybody always knows that. And, when you're going to see your physician or your nurse practitioner or physician assistant, some women will just say it hurts down there or it's irritated down there. And it's frustrating. And sometimes it is the vagina. It can be the urethra, can be the clitoris, the Skene's gland, the Bartholin's glands, which sometimes can get infected and obstructed, as well as just the skin, the outer lips or the labia majora, and the inner delicate non-hair-bearing areas are the labia minora. And conditions that can result from an infection can be from various types of organism, like a bacteria, Gardnerella, can be overgrowth in bacterial vaginosis. Yeast, pretty much any woman has had an experience with a Yeast vaginal infection, more common if you're ingesting a lot of sugar or if you're too sweet with diabetes and have too much elevated blood sugar. I was just reading a stat where years ago, the average human consumed about 2 pounds of sugar a year, and now it's gone up exponentially. So really try to get as much sugar out of your diet as possible. And then, of course, viruses. One of the most common ones is herpes simplex, usually type 2, but could be type 1. There's lots of things that can irritate the delicate vulva. And I tell women as they get older, their skin becomes more delicate, particularly around the nipples and the genitals, and you want to treat your skin in those areas very gently, just like you did with babies and young children who have more sensitive, delicate skin. So there's lots of chemicals and sprays and creams, even clothing, colognes, dryer sheets. I usually say don't wash your or dry your underwear or bras with dryer sheets that have various chemical residues. Try to wash your underclothing using like baby type laundry detergent that's hypoallergenic. Use a double rinse and either air dry if you're in a climate that you can do that, or in the dryer without the dryer sheets. And in some cases, of course, vaginitis can be sexually transmitted with organisms, bacteria, virus, parasites that are passed between sexual partners. And in women that have lost their estrogen without any kind of replacement or any kind of hormonal therapy or non-hormonal options that help support the tissue, certainly the fragility and thinness and dryness can affect the tissue integrity as well as the microbiome and the predisposition to infection. So let's talk about the common types of vaginitis. Canada, the kind of lay term is yeast vaginal infections. Bacterial vaginosis, which is a condition, it's more of an overgrowth of bacteria that's normally there, but just in different amounts. Trichomoniasis is another type of parasitic vaginosis or vaginitis. Actually, it is an infection that can be treated. Gonorrhea and chlamydia are two common bacterial sexually transmitted infections that can infect the uterus and tubes and cause some pretty serious conditions. Viral vaginitis, primarily herpes. There's non-infectious vaginitis. There's desquamative vaginitis. And then the atrophic vaginitis seen in postmenopausal women, GSM. Now, 80 to 90% of vaginal infections in women that's a yeast infection is from Candida albicans. And vulvovaginal candidiasis, VVC, is the second most common cause of vaginitis and generally can be more annoying for women who frequently have this type of infection recurrently, because it's not just of the vagina, but it's also of the vulva. And it's perfectly normal to have Candida live in the vagina. Sometimes you even see Candida called on routine pap smears. If it overgrows, though, it can cause inflammation. And this can lead to some typical symptoms of burning or itching, redness, pain, and the classic thick white cottage cheese discharge. So why do some women experience more frequent yeast infections than others? Well, there's many factors or triggers that can predispose a woman to having a vaginal yeast infection. And some of the common ones is, as I mentioned earlier, is sugar. Get sugar out of your diet. Be less sweet. Consider intermittent fasting if you're not pregnant and you're fully grown. Use of antibiotics, that unfortunately kills off good bacteria in your gut microbiome as well as the vagina. High estrogen level states, like super high estrogen level states like vagina, help the vagina get thicker and more elastic so a 10-centimeter baby's head can come out. And with all that extra estrogen and blood flow and nutrition to the genital area to make it elastic and able to undergo the rigors of childbirth, there is increased glycogen many times, which provide a very favorable environment for yeast to grow. We don't tend to use really super duper high doses anymore of estrogen containing contraceptives, except if a woman is maybe having recurrent painful ovarian cysts or is on medications like anticonvulsants, which make one metabolize it faster. Uncontrolled diabetes is probably the most common issue that we see. One needs to always be concerned about human immunodeficiency syndrome, HIV, or any condition that can negatively affect someone's immune system. I am a big proponent for regularly pushing adequate vitamin D3, K2 levels. Vitamin D is not a vitamin, it's a prosteryl hormone. Last season's podcast 3 was all about vitamin D. And I've seen many cases where women correct their vitamin D deficiency and their recurrent BV, recurrent yeast vaginitis either goes away or becomes much less frequent. And the same thing is true just in general with good nutrition, a healthy whole foods diet, getting enough sleep, not smoking, reducing stress. All of those things help your body live in symbiosis in a healthy manner with all of these organisms that we usually coexist with and don't have a problem, but sometimes they overgrow and take over our defenses. Now, sexual activity is another potential risk factor. The vagina is known to have a healthier microbiome when it's more acidic than blood. And semen is alkaline and can affect the acid levels in the vagina. Having regular menstruation, particularly if it's heavy and there's lots of blood for several days, blood has a higher pH than the normal vagina. That can be another trigger. Being in wet, soggy bathing suits, hot tubs, taking bubble baths with irritating substances. It really does not take too much to throw off the microbiome. Tight-fitting clothes, like, some of the underwear that's very, very thin, that kind of causes like a cord to be rubbing up against the vulva, could be another problem. Wearing very tight, constricting, unbreathable fabrics and tight undergarments, and just improper vulvovaginal hygiene. In general, we do not recommend douching unless it's medically recommended for a specific reason. It can shoot bacteria up into not just the vagina, but up through the cervix into the uterus. And a lot of these harsh sprays and soaps and things that are marketed to women to, quote, be clean down there are actually counterproductive.
We'll be back after a quick break.
Hey, quick question for you. Are you someone who wants to be fit, healthy, and happy? And what if I told you could get your dream body by simply just listening to a podcast? I'm Josh.
And I'm KG, and we're the hosts of the Fit, Healthy, and Happy podcast.
Listen, we get it. Fitness isn't easy. Carbs, no carbs.
Just stop, okay? It doesn't have to be that complicated. And that's why we made this podcast. We get straight to the facts so you can become your best you.
So the way to check us out is click the link in the show notes or search Fit, Healthy, and Happy podcast on any of the major podcast platforms. We'll see you soon.
You have been listening to the Speaking of Women's Health podcast, and I am your host, Dr. Holly Thacker. And this podcast is all things vaginitis, complicated vulvovaginitis. Well, as I mentioned earlier, the majority of we women experience at least one vaginal yeast infection throughout our lifetime. Half of all women will have at least 2 or more. And some women have had so many that they can't even keep track. VVC is considered recurrent when you have 4 episodes within a 1-year time period. So just like bladder infections are common in women, when you have 3 bladder infections within a 6-month period, that's an immediate red flag. You need to see a specialist and get it evaluated. So if you have 4 episodes in a 1-year time period, it is something that you should discuss with your women's health clinician. Periodic or persistent infection or treatment-resistant VVC occurs when a woman has symptoms for a prolonged period of time despite receiving what seems like adequate therapy. So since 75% of women will have at least one episode of VVC in their lifetime, that's a lot of women. But about 10% of them will experience the recurrent VVC. There was an international survey of 6,000 women that showed by age 25, 10% of women who had ever had a yeast infection had already gotten into that recurrent VVC category. So if it's recurrent or persistent, it's annoying and discomforting and can affect, home and work productivity and sexual activity and even potentially mental health. Subsequently, it's no surprise that any recurrent or prolonged experience with that has been shown to negatively affect someone's quality of life. So even though it's generally not ever a life-threatening condition and it's kind of an annoying part of being a woman, the more you know about it to be empowered to assess it, deal with it, treat it, and get on with your life, so much the better. So some of the tips to prevent this: maintain good vaginal hygiene, wear cotton underwear. We like cotton underwear. Very, very important. And when possible, you should minimize antibiotic use. Now, sometimes antibiotics are absolutely needed without a doubt. And so you just don't want gratuitous antibiotics, which many times are given. Now, uncomplicated infections are generally treated over the counter. And there's vaginal fluconazole, which is an antifungal treatment. If you see a healthcare clinician, there can be oral or vaginal azole antifungals, such as fluconazole, clotrimazole, ketoconazole, itraconazole, or turconazole. And many of these medications go through the liver and can affect metabolism of other medicines and may raise certain levels, like Addy or flibanserine. Now, the complicated or the recurrent infections are a little bit more difficult. They require usually a longer duration of treatment and use of a stronger azole antifungal, such as turconazole, or supplemental boric acid therapy, which is in general pretty inexpensive and can be very appropriate and helpful at getting rid of certain types of resistant candida, like the glabrata, which doesn't usually respond to the usual yeast medicines. And you might suspect you have Candida glabrata if you have a lot of burning. And when you have a vaginitis, the cotton underwear is important. Not wearing liners, even that would catch vaginal discharge or catch if you're putting local medicine in. A lot of women don't want to dirty up their underwear. Well, the purpose of your underwear is to protect your clothes, and you can wear more than one pair of underwear in a day. You're entitled to buy new underwear. And I tell some women to just keep a big bag of clean underwear and then a vegetable bag to put your dirty underwear in. So every time you go to the bathroom, if you don't like seeing what you're seeing, you can just change out your underwear. And that helps reduce a lot of recurrent irritations, some bacterial vaginosis symptoms, as well as helps sometimes in other types of problems. And I think this addiction, so to speak, of panty liners begets a lot of vaginal problems. I also think that the style of the thong underwear, which I've heard some physicians dub as anal floss. So it's good to floss your teeth, but you don't want to be flossing the bacteria from the rectum through that string back and forth to the vulva. So appropriately fitting clothes with good cotton underwear goes a long, long way. Now, in rare VVC infections, certain patients might need to be treated with a stronger antifungal, rarely, such as compounded amphotericin B or flucytosine. Those are usually in very immunocompromised sick patients. Some women may need to use longer-term prophylactic therapy with azole or boric acid, like on a monthly basis, to prevent recurrent VVC. And while many physicians, primary care, OBGYNs, advanced practice providers are capable of treating just run-of-the-mill uncomplicated VVC, complicated infections may require specialist care with the physician more experienced in gynecologic infectious disease. Now, one thing that was very, very exciting that came on board a couple of years ago was like the first new medicine in a long time to treat VVC, Brexafemme, which is the brand name of the generic ibrexafungerp. That's a mouthful. Brexafemme ibrexafungerp is an oral, non-azole, first-in-class FDA-approved therapy to treat vulvovaginal candidiasis and to reduce the incidence of recurrent VVC. So for most women, they don't need the big guns, so to speak. However, if you're in that class of women that is definitely affected and having recurrent problems, it's nice to know that there's another newer option. And approval was based on phase 3 data of the CANDLE study showing statistically significant superiority of ibrexafungerp over placebo for both primary and secondary endpoints. And it's actually fungicidal, meaning it kills the fungi candida. It doesn't just inhibit the growth. And there's another second indication for Brexafemme that was approved in December of 2022, over a year or so ago, and that was to reduce the incidence of recurrent VVC. And the second indication arms both patients and the healthcare clinicians. It gives us some more solutions to fight against severe fungal infections. So there's a few things you might need to know if your healthcare clinician prescribes Brexafemme. It's an alternative treatment for a subgroup of you must be non-pregnant and not breastfeeding. And it's primarily for women suffering from recurrent or that azole-resistant VVC. If you get treated for yeast infection and you don't get better, it might be a resistant Candida. It could be the glabrata species. The most common side effects of Brexafemme were just GI symptoms, stomach upset, diarrhea, nausea, and a little lightheadedness. You might wonder, with new medications, is it cost effective? And certainly the cost of new medicines are generally always the most significant barrier. The current cost prediction is certainly higher than many other medications over the counter or the fluconazole diflucan, which you may have taken. But it's 4 tablets, 1 day of treatment, 2 tablets twice a day. So the fact that you can complete your treatment in 1 day, I think makes it easier for busy women. It is justifiable if you have a recurrent infection. You can also potentially talk to your healthcare clinician about using boric acid suppositories. It's a nice alternative if you've tried other agents that haven't worked. And so certainly if you have recurrent VVC and you have multiple different prescriptions, you're going to see multiple different doctors or urgent care visits or making phone calls or doing virtual visits. it actually may be more cost effective to spend more money. And with any new medication or even old medications that are unfortunately priced ridiculously high, I would direct you back to last season's podcast on how to save money on medicine. Or you can just go on speakingofwomenshealth.com and put the word money in, and it will bring up a column that our nurse, Alexandria, has done that gives so many good tips that really everybody should know. So some patients that have albicans candida or azole resistant VVC may end up spending money out of pocket on compounded amphotericin B or flucytosine, which is generally effective in over 70% of this subset of women. But women who don't have access to a compounding pharmacist might just want to get Brexafemme from a pharmacy. It's nice to have old and new medications. Old repurposed medicines with a lot of experience are nice, but it's nice to have options that are convenient as well. So now we're going to move on to BV, bacterial vaginosis, which is the most common problem for women, females ages 15 to 44. And it's related to when the flora, bacterial of the vagina, allows overgrowth of Gardnerella bacteria. And this can classically lead to that fishy amine odor and a grayish colored vaginal discharge. So in essence, you've just tilted the scale to more bad bacteria instead of good bacteria. And when patients come to tell me that their body odor's changed, it means there's a change in the bacteria that they have. When people say, well, now I have bad breath that I didn't have before, well, that implies there's something different in the microbiome of the mouth or the gut. And it's the same thing with the vagina. And normally, a healthy bacteria in the vagina is lactobacillus. It keeps the pH of the vagina low and more hostile to the bad bacteria and yeast. But if that pH goes up because of menstrual bleeding, because of lack of estrogen, because of antibiotic use or semen, then with a higher pH of the vagina comes the death of the lactobacillus. And that can also happen with antibiotics. So if you have new vaginal symptoms, you should be evaluated. Could be sexually transmitted. It could be yeast, could be BV, or it could be a parasitic infection with trichomoniasis. Vaginal irritation and discharge can also be due to changes in the mucosal integrity of the vagina. Sometimes there's a retained tampon. I've removed, and so has my staff on more than one occasion, and the woman is mortified, but I just try to reassure them that, well, you're busy. The vagina is very expandable. A baby's head can come out. Sometimes people forget, they put another tampon in. There's also an autoimmune condition that's immunologic or allergic called lichen sclerosis. And that's a chronic condition, and it can cause itching, burning, tearing like paper cuts to the vulva. It can be misdiagnosed for infection or vaginal atrophy, or there can be infection and vaginal atrophy and lichen sclerosis. What we don't want to miss is vulvar cancer. And so if you have persistent symptoms, changes in the skin, you do need to go and get examined. So what are the potential causes and associations with BV? You're at higher risk of getting BV if you have a new sexual partner. If you douche, please do not douche. It shoots bacteria from the vagina up into the uterus. Poor diet is a common one, and low vitamin D. I've found so many low vitamin D levels in women with recurrent BV. If you're pregnant, if you have an IUD with a string, if you have had multiple sex partners, if you're taking antibiotics. So those can be issues. If you are sexually active and have recurrent BV, boost your vitamin D or get your levels checked. Have your sexual partner wash the genitals with plain soap and water before sexual activity. I always say that, men touch a lot of things, money, car parts, whatever they're touching. They go to the bathroom and then they wash their hands. They don't wash their hands first, pee, and then wash their hands afterwards. So there can be a lot of natural bacteria on the penis. Same thing with sex toys. They should be washed with warm, soapy water. And BV can be transmitted from, female to female adult sexual activity. Any woman with recurrent BV may want to wear plain white cotton underwear, as I mentioned, as opposed to thong underwear. I know people don't want lines on their pants, but you have to protect that vulva for sure. Now, if you have BV and you're pregnant, it can predispose you to premature delivery or even miscarriage earlier in pregnancy. And if you have BV and are exposed to HIV, you're actually more likely to get HIV and get infected with that. The way that BV is usually diagnosed is with a vaginal smear clue cells, which are epithelial cells with lots of bacteria. There's a quick vaginal DNA test in the office that can generally distinguish between BV, Candida, and trichomoniasis. There's lots of treatments for BV, like clindamycin used vaginally or metronidazole used either orally, Flagyl is one of the brand names, or vaginally. We usually have you avoid alcohol or even alcohol mouthwashes if you're on the oral. And sometimes tinidazole is used if it's refractory. But if you're pregnant or breastfeeding, you must let your healthcare clinician know. And we like to avoid the alcohol, even alcohol-based mouthwashes, if you're on metronidazole or tinidazole. Now, there is a relatively newer therapy for BV. In 2017, the FDA approved a one-day dose of Solasec, secninidazole, for non-pregnant women between the ages of 15 and 44. It's a 2-gram dose one day. It comes in the form of a 2-gram packet of granules that are mixed in like applesauce or yogurt or pudding. And you just eat the mixture within 30 minutes, and you don't chew the granules or you don't crunch them. You just mix it and swallow it. Since most antibiotics for BV have to be taken for 5 to 7 days, it's nice to have a single one-day dose. If the woman was to take this while breastfeeding, she should have to what's called pump and dump for up to 96 hours, which is a long time. So generally, we would use other therapies for a breastfeeding woman. And don't just assume that any irritation or infection can be treated with over-the-counter medicines. Be sure to call your women's health physician or APP if you have any BV symptoms like vaginal discharge, changes in color or consistency, or discharge that's different, or burning, or swelling, or soreness. And in my practice, I remember having to hospitalize one woman who had a terrible allergic reaction to Monistat, miconazole, over the counter, because some of these vaginal products, the vehicles in them can actually cause allergy. So I've had some women have minor conditions that then they've applied some kind of harsh chemical or antiseptic wipes or things that really are not appropriate for the vulva, and then it causes them down a cycle of more problems. So as my granddaughter Artemis would say, take care of those passports. Make sure that you pamper them and take good care of them so that you will have less of a chance of being bothered by these irritations of vaginitis. So thank you so much for listening to this Speaking of Women's Health podcast. Don't miss future episodes. Subscribe. Hit the subscribe or follow button on Apple Podcasts, Spotify, TuneIn, wherever you listen to your podcast. And if you've enjoyed this episode and you want to help support the podcast, please share it with others. You can also leave us a 5-star rating. And you can go on speakingofwomenshealth.com and hit the donate button if you would like to support our nonprofit to encourage women to be strong, be healthy, and be in charge. Thanks again, and I'll look forward to seeing you again in the Sunflower House.